EEG stands for electroencephalogram. It's a study that detects electrical activity in the brain. Your hair should be washed and dried before the study so that the electrodes have the best contact with your scalp. We'll start by taking measurements of your head, cleaning the areas where the electrodes will be applied. There are a total of 23 electrodes that are applied to the scalp with conductive paste that records the brainwaves. During the recording, there are two activations, photic stimulation and hyperventilation, that are performed during the EEG. The recording will be a minimum of 20 minutes and can sometimes run as long as 60 minutes. Photic stimulation is an activation where the patient keeps their eyes closed and a strobe light flashes on and off every 10 seconds for about 3 minutes at different flash frequencies. Hyperventilation is an activation where we have the patient breathe in and out through their mouth like they're trying to blow out a candle to kind of increase the heart rate and blood flow and change the oxygen CO2 mixture as we monitor the brainwaves. Long-term video EEG monitoring is a test where we measure your head, clean the scalp, and use a medical glue to apply the electrodes to the scalp so that they remain on for a longer period of time, minimum 12 hours, sometimes up to 3 days, depending on what your doctor orders. An ambulatory EEG is a study where a patient will come in and have the EEG equipment applied to them, and then they take the equipment home for 1 to 3 days, and most often it includes taking home a video camera to possibly capture any spells or symptoms that they may be having. If you have any further questions about EEG, you can contact our office.